I would like to go ahead and get started. I am Professor Roberta Lavin, and I'm excited to host the discussion about unaccompanied minors, and to be joined by the group of providers and participants that are with us today. So that being said, I would say let's go ahead and get started. And if we want to start, can we start with Pat?
Thank you very much. My name is Pat Frost. I am a former EMS director for Contra Costa County, and in that capacity, I worked as Medical Health Operating Area Coordinator. I'm also vice chair for the National Pediatric Disaster Coalition, working with our healthcare communities in terms of a coordinated response. And I just wanted to share my insights and also what we know about disasters and accompanied minors from more of a local and a regional perspective, and some of the challenges that we face in terms of getting people connected and engaged in this issue. Let me just advance this. Now, we know that disasters, really affect children, and if they become unaccompanied, there are very lifelong consequences associated with that. We heard that in the earlier speakers over and over again. But one of the main things that as an EMS director I was in charge of was really helping my healthcare community understand these issues and how they were supposed to plan. And what I found over and over again is that policymakers, both in healthcare and in our community and EMS emergency, had no idea about the resources that were available, how they fit together, or even where the children were, or where their risks in the community were. Where in contrast, they were very well versed in terms of where the fault lines were, where the flooding was going to exist, those types of factors involved. So community risk factors in a community really have to, I think, pay attention to who are the children in your community and where they're located during the day in terms of the congregate issues associated with how Dr. Markinson touched on. Where are their vulnerabilities? We know that 1 in 6 children in the United States are below the poverty line, and those have unique risks associated with it. And those risks are day-to-day risks. So, we should know a lot more in our communities as a disaster preparedness or readiness community about where the children are and where those risks are. And also know where our schools, our childcare, and our community is in terms of planning and preparing for that. And that is variable, and there's a lot of work that needs to be done in my experience with these issues. Now, the part of the challenge with unaccompanied minors is that our whole response system, from an EMS perspective and a first responder and first receiver perspective, really is geared towards response and not towards, protecting the short-term and long-term consequences of what may happen with children. During that period, it is chaotic. Our first responders are information challenged, and there are multiple handoffs that happen with children just as part of the normal, and that gets accelerated and people lose track, and children get literally lost in the system, secondary to gaps with our current response system. This is particularly true for no notice and short notice events. Now, Hurricane Katrina really was I think, a hallmark event, because it really began to focus attention on what happens to the consequences of children. And we know that 80% of New Orleans was underwater. 25,000, storm evacuees were evacuated to the Louisiana Superdome. And we saw at least more than 5,000 separated children that took in many cases, months and months. And the most famous being Cortez Stewart, who is in the right lower left corner, who was not reunited with her family until 6 months later. But, there were a myriad of systematic breakdowns in the response and the recovery, and the lack of infrastructure for families to keep their children with them, and also delays in families really knowing, and delaying evacuation because they may have wanted to protect their property, or, because there was literally no transportation available to them by the time they decided to move. They were moving too late. We know from anecdotal reports, both in the literature and, among my colleagues, as far as that's concerned, about, the National Guard base in Oklahoma. That was a shelter for 1,600 evacuees, receiving 300 children, 14% who were there without a legal guardian, and the 10-year-old boy who arrived without families or friends, the 9-year-old traveling with an invalid grandmother who couldn't care for them, or the 4 siblings found to be in the care of an unrelated man who was a sexual predator at the time. Now, foster services with Louisiana struggled during that time to locate the 500 foster children, and law enforcement lost track of sexual offenders during that period as well, because of the chaos and how many people had to be moved so quickly in all different directions. Certainly, the consequences for individual children basically can be characterized in a number of different ways in terms of both survivors and evacuees. Survivors, the children who actually stayed in the area; evacuees who were moved, states away, as far as that's concerned. But, the 7-year-old girl who was rescued from floodwaters by a boat and was placed in a shelter apart from her family, and then when reunited was found to have multiple cigarette burns that were that she had experienced in that shelter, and she was not protected enough. The 8-year-old boy who was evacuated from floodwaters, where he witnessed dead bodies floating by while he was trying to find his family, and evacuated to a Texas homeless shelter, suffering from PTSD, anxiety, and disruptive behavior at school long term. So all sorts of terrible stories and consequences that really just are the tip of the iceberg in terms of what we know with separation. In Superstorm Sandy, we see the same kinds of things, a little bit different as far as that's concerned, but really speaks to what communities have as their infrastructure to support the homeless children. In New York City, they lost 230 homeless shelters due to the storm surge and had to relocate 300 homeless families. Homeless youth and LGBT youth programs were disproportionately affected, according to the Coalition of Homelessness. And homeless youth had desperate needs for emergency shelters that were already overcrowded. Sandy resulted in nearly 8,700 students temporarily living in shelters, motels, or doubling up with families. And, again, the population at risk included the children and families where the poverty rate in New Jersey was, 10 to 11%. That really puts families at disadvantage. It increases the risk for separation and also recovery of the families associated with it. in the California wildfires, Paradise is about 124 miles away from Contra Costa County, where I was the EMS director. And so we deployed both Medical Reserve Corps as well as ambulance strike teams to support the evacuation within hours of getting the call. And our first responders were literally kicking down doors to the homes to support evacuation in ambulances. When my team arrived at the medical shelters that were initially set up, they had to then move those shelters 3 additional times because the pace of the wildfire was threatening, and people were literally, running for their lives. At the height of the fire, it was equivalent of a football field was burning every second for 2 days. Really an out of control situation, and that really challenges any systems or planning, pre-planning that we had around children being separated. But some 2,500 children were reported evacuated through those conditions where the fire was burning all around them. We had a 14-year-old who was in charge of the care of their kid's sister, unable to reach their parents and had to be evacuated. A student teacher who evacuated students from Paradise Charter Middle School to shelter 30 miles away without being able to get in touch with their families right away and being able to deal with that situation. The bus driver who on their own realized the damage and went back to evacuate 22 students in Ponderosa Elementary to safety miles away. Again, without time to notify or contact parents. And in
we need to kind of wind up here.
Oh, okay. And in Paradise alone, a dozen foster families that were impacted. So my last slide is that there are best practices that are talking about reunification, but the most important thing is not to separate them in the first place and to have an infrastructure in place. And that requires toolkits, training, champions, and coalition building. And we certainly do not understand each other's roles on the local and the regional level well enough to coordinate those services. And there's so much work that has to be done. We have great best practices, but translating those best practices into operational and actual practice is a whole nother animal. So with that, I will end. Thank you.
Thank you, Pat. The next speaker up is Jeff, and if you and just a reminder to the panelists before Jeff Daniels takes over is that if you watch your chat box, we'll give you a 1-minute warning, and we think that'll help everybody. So please, Jeff, you're up.
Okay, can you hear me?
Yes, we can.
Okay, I'm going to try to share my screen here, okay? Are you able to see my
yes, we are.
See my presentation?
Yes,
okay, great. Okay, excellent. Well, I am a regional program manager in the Administration for Children and Families under the Family and Youth Service Bureau Runaway Homeless Youth Program. And the nice thing is some of the programs that we provide discretionary grants to are linked. We happen to have one there in Paradise, so we can talk about some of the results of what happened there in sort of a segue for what Pat had said. But I wanted to just give you a quick overview of what we do. So here are our primary programs, and they're pretty self-explanatory. We provide discretionary grants to grantees for the Street Outreach Program, Basic Center Program, Transitional Living Program, Maternity Group Home. These are the population that we serve and really the purpose. Street Outreach is pretty self-explanatory, very basic. We're out there on the street, the grantees are, talking to youth and ideally trying to provide some of the basic things for them: emergency shelter, survival aid, blankets, water, things of that sort. Ideally, we either try to connect them with the family or we can steer them into one of the basic center programs or transitional living programs. So our basic center program really is for runaway and homeless youth under the age of 18 years old. Again, self-explanatory. They can stay in the shelter for up to 21 days. These shelters provide food, clothing, and medical care. We do counseling, crisis intervention, recreation programs, and aftercare services. So that's really the primary program of our main program. And again, the key here is runaway and homeless youth. We define, and I say we, the Family Youth Service Bureau defines a runaway youth as a youth that purposefully leaves the home, whereas a homeless youth can be up to 22 years of age who becomes homeless under certain circumstances that really isn't any fault of their own. So two different distinctions there with the kind of youth that our programs serve. Our transitional living program, again, it's for the youth that are between the ages of 16 and 22. As you can see there, the living accommodations for our transitional living programs have a vast array of different ways of doing it: host family homes, group homes, supervised apartments. Now, getting back to unaccompanied minors in an emergency situation, we did happen to have a host home in Paradise, California. And some of the lessons that we learned from that was, clearly you've heard in other presentations or even with Pat, is that the emergency preparedness plan was critical. 22,000 individuals displaced in Paradise in that fire. I know that number changes, but we happen to, the nice thing is some of the results from a grantee that we had in Paradise, within hours, all of the children were accounted for, the staff was accounted for. It happened that we had 2 clinicians that were working with that grantee whose homes did burn down. One of the lessons that we learned was we were able to provide, not we, but the organization coupled with our federal project officers, were able to establish a temporary assistance location so that this individual grantee could set up shop for that. The key, though, and you heard it before, was their emergency preparedness plan. They were working with the California Social Services and various community leaders to put together that plan for certain circumstances that happen. Here's our population of who we serve with our money. So just want to share with you all that these were the individuals that were affected in this particular emergency. And then, of course, we have a maternity group home, which really is for homeless, pregnant, and or parenting young children, or people rather. And again, same ages, 16 to 22. It works similar to TLP services, but there's additional services for parenting skills, child development, family budgeting, and health and nutrition. That's really all I have. I'm happy to answer any questions regarding the Paradise situation and then other aspects of our program, but that's our population, what we focus and what our grants focus on. Thank you. Roberta, I think you're on mute. I can't hear you.
I was on mute. I forgot I muted you.
There you go.
My background.
Okay.
My air conditioner.
Leanne, did you get the screen back? Were you able to get the screen back, Roberta?
We do have the screen back. Thank you.
Okay. All right. Great.
Leanne, are you with us?
I am.
Thank you. You are up.
Okay. I'm going to turn my video on. I'm going to pre-apologize for any background noise. I have a little bit of a thunderstorm behind me. So if you hear any startling noises, that's probably what it is. So I will go ahead and share my screen. Okay, can everyone see that?
We are about to. It is.
Okay.
We got it.
Perfect. All right. Well, thank you so much for having me today. My name is Leanne McCallum. I'm the task force coordinator for the Greater New Orleans Human Trafficking Task Force. So I'm lucky enough to be in a community in Greater New Orleans where I get to learn from folks who lived through Katrina and sort of have community-based lived experience. And then also my background is really in international human trafficking response. And so I sort of bring together a combination of recognizing local response to global issues. And so my contribution today is going to focus on sort of general frameworks for understanding vulnerabilities of unaccompanied minors to human trafficking in a post-disaster context. So human trafficking is a term that we hear a lot, but I want to make sure that the definition is clear for you all. Sex trafficking is when a person is recruited, harbored, transported, provided, obtained for the purpose of commercial sex, so trading a sex act for something of value, in which that act is induced by force, which is physical force, fraud, which is trickery, or coercion, which is the psychological control. Or if a person is under the age of 18 and engages in any commercial sex act, regardless of the presence of force, fraud, or coercion, it's considered human trafficking. Labor trafficking is the same. It's when a person is recruited, harbored, transported, provided, or obtained for the purpose of a commercial labor service through the use of force, fraud, or coercion. So when we're talking about unaccompanied minors, both labor and sex trafficking can happen. We know that young people do engage in survival sex, trading commercial sex acts for something of value in disaster contexts. And something of value is not just money, it's shelter, it's food, it's protection, it's basic needs. And so we need to be really, really mindful that this can happen in a disaster setting in the domestic space as well as internationally. Force, fraud, or coercion in the case of labor trafficking is a really critical component of the crime. So I just like to offer this as a reminder of what that can look like. It can be lack of mobility. So if a person's physically isolated as the result of a disaster, not able to get anywhere, can't drive, reliant on a caregiver, if they're stuck in a debt bondage situation, so hey, you have to sell 10 of these before you can sleep here. You have to pay off this debt, you can't leave me. These are some of the ways that young people are maintained in situations of abuse. Threats of violence, physical, sexual abuse, lack of payment, or recruitment fraud are common as well. Telling the young person, oh, you're gonna go be a nanny, but then they get to where they're working and they find out that they're actually being forced to engage in commercial sex acts or do another part of work. The biggest difference between trafficking and other crimes is the inability to walk away. If a person doesn't feel able or physically isn't able to leave a situation. So particularly for unaccompanied minors during disasters, there are some specific vulnerabilities that emerge. Homelessness and displacement are really critical because young folks get disengaged from support systems, family units, parents, and really a community that can look out for them. Young people, their brains aren't fully developed to sort of understand the difference between good help and bad help. And so when somebody comes offering, hey, I have a place you can stay, I'll feed you, I'll take care of you, they may not recognize that that person is an exploiter. Basic needs like food and water and shelter need to be taken care of in a disaster setting, and young folks will rely on others to provide that. Social isolation and physical isolation can lead to abuse. A lack of a way to make money or take care of themselves. Trauma is a big issue for young folks. Lack of protection from law enforcement and labor rights. As systems sort of break down, like what we saw in the post-Katrina era, where groups like the Department of Labor, for example, were closed for 2 months. And then when they did reopen, it was out of a strip mall. We know that our protective systems aren't always able to go and find those young people who become separated from family units and caregivers. And then limited interactions with mandated reporters and safe figures in child's lives can be a huge issue. A lot of times, you know, if a child's engaged in service provision or is engaged in school, those parents become mandated, they become aware of potential abuses and report it. In a post-disaster setting, there are some particular subsets of young folks who are extra vulnerable to labor trafficking and sex trafficking. That's children without parental care, so that would be orphans, unaccompanied minors, so unaccompanied alien children, UACs, our migrant youth, those folks can be vulnerable. Children living on their own in homeless shelters or in foster families, or youth who are institutionalized. Young people with physical and mental disabilities are highly vulnerable because they're susceptible to control and may rely on a caregiver in a way that makes it even more difficult to leave abuse. And then children from marginalized groups, like groups of ethnic minorities, tribal minorities, and religious groups. So in the humanitarian response setting, there are some lessons learned that we've found in post-disaster settings in which trafficking of unaccompanied minors has happened. After the 2004 Indian Ocean earthquake, there was a lot of children that became orphans or lost their caregivers. And as a result, false adoptions came up, forced labor of those young people in forced begging. In the 2010 Haiti earthquake, there was a similar issue with false adoptions, forced commercial sex, and then displacement as well. And then in the Nepal earthquake in 2015, we heard a lot of anecdotal information from the field of the false adoptions and of young people being forced into the sex trade. And so we know that these are possibilities outside of the US. Child marriage can increase during disasters, which is a form of human trafficking. And there are a variety of other abuses that can occur. So I'm happy to talk more in the Q&A about human trafficking and unaccompanied minors, but I think that is my piece, so I will stop sharing for now.
Thank you very much. And if we can move on then to our last presenter, who is Joy Paluska.
Hey, I'm gonna just try to share my screen here. Forgive me.
And we see it, thank you.
Wonderful. I always, okay. Just really quickly, my name's Joy Paluska. I work with the National Center for Missing and Exploited Children. You're gonna hear me say our acronym NCMEC for pretty much the rest of our presentation because it's a mouthful. So when I'm talking, I'm gonna reference our organization that way. So today I'm just gonna do a really quick background on NCMEC and how we sort of came into existence, our role during Hurricane Katrina, and kind of our role in disaster preparedness and response as a post-Katrina, and then a tool that we created called the Unaccompanied Minors Registry. So we were founded, as you can see here, in 1984. Some folks on with us might remember John Walsh from America's Most Wanted. His son was found murdered in Florida in the early 80s, and during that time period while they were looking for his son Adam, who I want to just call out his name because I will refer to Adam in a little bit later, there was no really coordinated response for a missing child. There was actually more if your car was missing than if a child was missing. So John and Reve Walsh really took it upon themselves to really take the worst tragedy and change the lives of other folks in our country, and just how we respond to missing children incidents and also exploited children. So we are a nonprofit, but we are about 70% DOJ funded, and the rest are private funds and resources. So our mission is to find missing children, reduce sexual exploitation, and prevent future child victimization. This slide just gives a quick picture of all of the different programs that NCMEC supports. I'm in the Missing Children Division, so I'm going to kind of talk from that side, but a lot of the issues that Leanne just covered, we work very closely on our exploited side and have a lot of resources. We work with the marshals, with tracking sex offenders, and just have a lot of resources for families. Please visit our website, missingkids.org, if you want to see more about all of our resources. So in the interest of time, I'm going to move us forward. Here's just some definitions that I wanted to go through. We consider a missing child a person younger than 18 whose whereabouts are unknown to a legal guardian. Again, that's a federal definition. A separated child is a child separated from both parents or their primary caregiver, but not necessarily from other relatives. And an unaccompanied child or minor is a child who's been separated from both parents, relatives, and is not being cared for by an adult who by law or custom is responsible for that. So just by way of background, I think we talked a little bit about Hurricane Katrina and also the last child who was recovered. I used to sit by the case manager who had that case, the Cortez case. So what I like to say is basically whenever NCMEC kind of does something good, Congress says, okay, now you're mandated by law to do that. So as you can see, we handled over 34,000 calls during Hurricane Katrina. We had over 5,000 missing child cases. And so we got written into PEMRA, the Post-Katrina Emergency Management Reform Act. And as a result of that, operate a few different programs that I'm going to talk about in a second here. So just, we've kind of talked a little bit about Katrina, but we see the number of folks, 200,000 children. We kind of, like anyone who was working during that knows what a kind of nightmare it was. I think the positive thing that I like to say is from that really horrific time period, we have such great, we've made such great progress. So that's the one positive thing that I will talk about with Hurricane Katrina. The issue for us as an organization that's trying to find missing children, it's always photos. It sounds very simple, but photos can be some of the hardest things for us to get from families for a variety of reasons. And so that's just an issue that we are always working with. So as you can see, I wasn't at NCMEC during this time, I was at Red Cross, but one of the things that folks started to realize they could use the school photos. Okay, so as I mentioned, after PEMRA, NCMEC really started to get in much more of a preparedness space. So we are very close partners with FEMA, the American Red Cross. We have an MOU with the American Red Cross, and we are a FEMA contractor. So if there is a presidentially declared disaster and missing children are a concern, FEMA can contract with NCMEC, and we would deploy our Team ADAM consultants. So our Team ADAM consultants are retired law enforcement who usually have a very specialized skill either in search and rescue or unidentified remains. They just have a variety of different skills. And so we can deploy our Team ADAM consultants to help find missing children. The TACs were deployed, we call them TACs. They were deployed for Harvey and Maria to Texas and Puerto Rico. And again, just if you think about Hurricane Katrina and the number of cases that we had, about 5,000, for the most recent disasters, our calls were under 100. And it's not because, the resources weren't there. It was just, I think, as a result of all of the planning and preparedness that exists as a result of Hurricane Katrina. So the other thing that we will operate during a disaster is the National Emergency Child Locator Center. That really is just our call center, which operates 24/7. all year long, but during a disaster, we will have a special phone number, and we will usually ramp up our call center staff just so that there are enough folks who can handle any calls. The other resource that was created, I think everyone probably heard from Laura Lee Kogiel earlier today from FEMA. She was one of the chief architects of our Unaccompanied Minors Registry, which I'm going to go into just a little bit more detail in a second here. But those are basically the 3 resources that during a disaster.
You're in a minute.
Oh dear. So I just want to say also in terms of preparedness, because it's come up a lot on these different workshops, we have a lot of preparedness materials, not only for families, but for organizations, and we're always trying to get states to write us into their emergency operations planning. So let me just quickly talk about our call center. So this is the Unaccompanied Minors Registry. If folks want to just write down this address, but this tool was put into place to help reunify unaccompanied minors. So when you do go to the website, it's a very user-friendly. Since I'm short in time, I'll just quickly kind of go through here, but you can report a single child. Here, again, like I mentioned on a previous slide, a big thing for us is photos. So there's a place where photos can be uploaded, and we can get those posters created or whatever resource that we want to utilize to help find a missing child. You can also report multiple children. So I know I'm out of time, forgive me. And I'm happy to answer any questions and appreciate the opportunity.
I want to thank all the panelists, and we did want to open it for questions. And right now there aren't any in the Q&A box, so I'm going to start by asking each of you a question. And I think that my first thing is, are there any gaps that you can personally, that you've identified that you think need to be addressed?
Roberta, this is Pat. You know, one of my experiences has been is that I am adjunct faculty for the National Pediatric Disaster Preparedness course. And within that, we have the opportunity to travel across the country and talk to groups who are typically multidisciplined and give them information about the resources that are out there and the most common risks associated with disaster, and have a whole section on, you know, reunification and that type of thing. And I am struck by the fact that there are many people who are in the role of being either first responders or in emergency management who do not really understand how those resources work and how they would connect with them in a disaster. And so we're actually giving this information to them for the very first time. So we have a lot of work to do in terms of, you know, making sure everybody has a level playing field and their awareness of resources.
Thank you. Any other panelists on gaps that you know of?
Roberta, I'll just jump in here and say, I think one of the things that's helped with some of the grantees that do serve our youth population throughout the country, we put together the emergency operation plans or emergency preparedness plans. Some of the gaps that we saw was, where can these grantees go to? They can go to other grantees, obviously, but FEMA has a great resource. They actually have an emergency operations plan that includes 6 critical elements, sort of the foundation of every emergency operations plan. They do touch on very briefly on some unaccompanied minor suggestions. So just to offer that as far as a national resource that could possibly fill a gap of where to begin.
Thank you. One of the things that comes up is what are the common core needs that we have, and you all presented some of those. Youth that are homeless before a disaster, and people that are trafficked or exploited before disaster, particularly children that basically are trading sex for those Maslow's hierarchy of needs, those bottom two rungs. My question is, how might those needs be made worse by a disaster? I'm specifically looking at probably Joy or Leanne on these, about your thoughts.
Sure, I can't see Leanne. I think maybe I'll just speak quickly, but just to, she kind of talked about this in her presentation, and it's just like during a disaster, your life is uprooted, right? So we know that during disasters, there's a higher risk for child sex trafficking. People aren't making the same decisions that they would normally make, or they're in financial distress. We do see even the familial trafficking during disaster. You're being trafficked by your family, not necessarily, the traditional pimp. So definitely during disasters, these young kiddos are at an even higher risk. But I think Leanne is still on, so I want to let her, as the expert in child sex trafficking.
Yes. So I think what's really important about disasters is, first of all, one of the key components that makes trafficking different than other crimes is that commercial component. There's child sexual abuse. Human trafficking is that commercial component. And so we know during disasters that there are disaster capitalists, there are abusers who take advantage of that. They go and recruit during that time, or they try to find new ways to make money. And so in the post-Katrina context, we know that there were young folks who were forced to do construction in really unsafe conditions because they had no other way to make money or have housing. We know that, child sex abuse was happening, child sex trafficking, because those young folks suddenly got sort of detached. And so I think one of the biggest issues, especially with child trafficking, is the folks who are able to identify victims are disconnected from those victims. And so that's a really important issue of identification, because unfortunately with traffickers, they're always trying to make money. It's just a disaster changes the game in terms of access to potential victims and also new methods to make money.
What do you think are the major challenges of meeting the needs of basically homeless, but also missing youth?
For missing youth, for our data at NCMEC, most of our missing children are endangered runaways. I don't even like to use the term runaway because it gets this perception that they, we know that they are missing on their own accord, but the reality is as we know, their brains aren't fully developed and they're making different decisions. So I think for us, there's just such increased vulnerability to a missing child, endangered runaway, endangered youth. And they don't have the protections or the support network. And sometimes they might even be in a situation where the person who is supposed to be their trusted adult is exploiting them. So I just think I'll defer to Jeff also.
Yeah, I mean, turning to Jeff, one of the things that you did was you talked about how you had 22,000 people at the Paradise wildfires that were separated, and yet within hours, all the children were connected with families. And there's a part of me that wants to know, what's the best practice that made that possible?
Yeah, that's a great question. I think one of the lessons learned that we took away from that was that particular organization, from my understanding anyway, had an emergency preparedness team, and fortunately they were able to. That team went into action as the fire got closer, and I guess certain preparations were made during the course of what was happening. But I think the key, it goes back to obviously communication, having the right people in place, the resource and assets, the safety and security, knowing where to go, a contingency plan, if you will, and then very specific staff responsibilities, I think was the key for accountability and safety during that particular emergency. At least that's what some of the after action that we were told and got to be privy to. So those are some key ingredients. You know, you had mentioned about how runaway and homeless youth are sort of steered to safety. And I'll just echo the program that we have, and I know several other great organizations have it, but it's the street outreach. I mean, that is one of the key. We do have drop-in centers, or at least some of the organizations do, and youth become aware of these drop-in centers in their community. But it's having a very strong street outreach program, and you'd be surprised at some of the things that I've seen regarding street outreach. You have one idea of it, but in various, it really is very different geographically. I'll give you an example. In certain rural areas, our street outreach, they were literally going into the woods, into the forest to find youth, where that obviously is not going to happen in inner city. But those are just some of that's the wide range of scope of that street outreach, of how each geographical community can come up with creative and imaginative ways to go and seek these runaway and homeless youth out, rather than just having a drop-in center and assuming that these youth are going to come and get help. I think being very proactive, we've seen, has been advantageous to some of these runaway and homeless youth.
All right, and with the few minutes we have left, I would like to take the opportunity to have each panelist give me a quick 30-second, your elevator speech about either the best practice your organization has, a way that you shift during disasters, or one quick point you want to make. 30 seconds each. Why don't we start? Go ahead.
Sorry, this is Joy from NCMEC. I would say that for us, just the preparedness, right? If we are prepared and we are thinking about these things before we're in a crisis, we're in such better footing, right? So that's why we have the resources for our families to be thinking about this, but also try to build up all of our relationships with state partners and share the resources that we have. Because if you're prepared, right, I'm in the bucket of preparedness. I think that's the elevator speech I would always give.
Thank you.
From my perspective, I think, you know, in terms of both the local and state and federal, I mean, ESF 8 and ESF 6 is so tied to support children. You know, it's critical that we really need to facilitate the dialogue between health, human services, health and human services, and the healthcare system, because right now they're kind of separate in so many ways.
Thank you.
I would just say if you fail to plan to fail, having a holistic approach, interconnectedness within your community, knowing your resources, having a good emergency plan. That would be my spiel.
And mine would be to integrate anti-trafficking and domestic violence response into immediate aftermath planning, just like at the humanitarian response level, how like the IASC has it. I think our domestic response needs to reflect that, because it is life-saving to integrate anti-trafficking and gender-based violence response into our emergency protocols, alongside education and some of these other things that folks don't see necessarily as life-saving, but it is. So that's my advocacy point.
Well, I want to thank all of you for being part of this panel.